Hey everyone, I'm Dr. Shania from Gulfcoast Eye Care, and today we're going to be talking about how to get rid of those glasses and contacts. So if you've been wondering about Lasik and other type of options like that, then this video is for you. So I actually got a chance to go over to Dr. Mike Manning's office, which is Gulfcoast Eye Care, and he's the lead surgeon for that office. And we talked to Dr. Brad Austin, who's another optometrist like me, except he actually had Lasik in the past. So he gets to share some of his experiences and how we made those decisions. So today, I actually want to break down more options for you so you know, and Lasik is not just the only option or cataract surgery, there's actually quite a few other options out there. So based on your lifestyle, based on your vision, there might be better options for you than just LASIK or cataract surgery. Our goal at True Focus is to provide eye care and vision-related education and advice to our patients, whether they're in our office or not. So now we're actually going to go to a different office and provide that education, and I hope you enjoy it. So today, let's focus on vision correction surgery with Dr. Mike Manning and Dr. Brad Austin. Okay, now that we're settled in here, I want to introduce you guys to these two doctors. If you want to go straight into learning about the different type of vision correction surgeries, if you look down, we actually have chapters for this video, and you can just go click right to that subject that you want to know more about. Now, if you want to know more about Dr. Manning and Dr. Austin and I, then stick around and check it out. We have Dr. Mike Manning and Dr. Brad Austin. Now, Dr. Mike Manning is the lead surgeon here at Gulfcoast Eye Care, and he specializes in corrective vision surgery. So, Dr. Manning, can you tell me a little bit about how you came to be in ophthalmology and how you found yourself in Central Florida?
Sure, yeah. So I found myself to be in Central Florida really when I moved here at the beginning of high school with my family. So we moved from St. Louis, Missouri to Orlando, come to enjoy Florida and been here mostly ever since. Went away for residency, but really have found myself here ever since. Did medical school in Tampa, and so that's what brought me to this area. In terms of ophthalmology and vision correction surgery, I found my way into that field really discovering towards the later part of medical school that I was interested in ophthalmology. Ophthalmology for me combined a number of really neat things, a chance to get to know my patients with a real high technology field, also with surgeries that were very high success rate, which really I felt gave me a real gratifying feeling as a surgeon. So really a combination of a lot of things.
And now this is Dr. Brad Austin. He's an optometrist in this area in Central Florida also. I'm going to let him tell you a little bit about that as far as what he does here and the type of practice that he has. But he also went to school with me at Nova Southeastern University, so it's a lot of fun to be able to practice pretty close by to a friend. So Dr. Austin, can you tell them about how you became an optometrist, why that was something that interests you, and again, how do you practice optometry that's a little different than I do?
Yeah, absolutely. Thank you, Dr. Shania, for the introduction. It's a pleasure being here with you, Dr. Manning. I became an optometrist because I love everything that comes to the eyes. I remember the feeling of having my first pair of glasses with the eye doctor when I was about 10 years old. And I'm sure many of you can relate. You put on your first pair, you walk outside, and it's like, wow, I can see the leaves on the tree for the very first time. And it's like, it's a world-changing experience. And to be able to have an opportunity and have a career where you can come in every day and change somebody's life in a small or a big way, that was a great opportunity and something that I really wanted to get into. I've been practicing here in the Tampa area for about 5-6 years now. I actually am the CEO of Elevate Your Existence, LLC, and the goal of my company is to change the way you see the world. Where we pretty much operate on is pretty much making sure that our patients have the greatest experience and that they have a good time with us and that you're able to see as well as you can. Pretty much why I became an optometrist was to be able to provide the best care for the people that we see. And so it's awesome to have an opportunity to be here with Dr. Shania and Dr. Manning to present some of the things that we deal with on a regular basis and just to give some more information about the things that you guys can look forward to when it comes to these types of surgeries, and just to alleviate some questions and concerns that many people have that we see on a regular basis and that Dr. Manning deals with, I know, on a daily basis. So thank you for checking out the channel and for checking out the video.
Yeah, and you bring up a good point. We see a lot of patients that, for one, they think either I know everything because I checked it out on Google,
or I just don't know enough. So we have those whole spectrum of patients that we get. And that's really what this video is for, is to go into those commonly asked questions about all these things related to vision correction surgery. So as we go through this, don't be afraid to just go ahead and comment down below, and I will always try to answer every question that I see on there, but I'm also going to challenge Dr. Manning and Dr. Austin to take a look every once in a while and also ask those questions that maybe I didn't answer well enough. So let's get straight into the first question, and this one I'm going to give to you, Dr. Austin. As simply as you can put it, what is refractive surgery or vision correction surgery?
So I guess to put it simply, as you asked, refractive surgery or vision correction surgery is using some type of equipment, some laser, some device that will allow us to reshape the surface of the eye or reshape some part of the eye in order to enhance the vision, whether that be on the surface of the eye with the lens inside the eye. Through various methods and different techniques, we can pretty much change the way you're able to see.
To break it down further, as you mentioned, in terms of different versions, many are surprised to know while many of our patients have heard of Lasik and tend to associate that with vision correction, they're often surprised to know that we have several modern variations of vision correction, really more than a handful. And so these include procedures that are corneal-based procedures, and those might include things such as Lasik, PRK, Smile, and then there are those procedures which are more lens-based, which includes ICL, also called Visian ICL, or refractive lens exchange, as well as refractive cataract surgery.
So as you guys heard, there are a lot of different ways to correct that vision and get you out of glasses. So we're going to break down each one of those in future videos. So make sure you check those out and you'll be able to find them in the playlist for vision correction surgery. Now, Dr. Austin actually has the unique privilege of being a doctor who also had LASIK surgery. And that's something that's been very helpful for him to be able to talk to his patients about what to expect. And there's a big side about how this procedure is going to work, but there's also an emotional aspect to this as well. There's a lot of patients who really want to have some kind of surgery done, but it's the anxiety that kind of keeps them away from it. So in your perspective, how can you break that ice easily on a patient? And I'll also ask you, because you get this all day long, of I really want to do this, but I'm really nervous about it.
Yeah, 100%, Dr. Sinai, and thank you for asking. After having had LASIK done myself about 5 years ago, it's really been a life-changing experience. And in many cases, you don't know what you don't know. People come to us for the guidance in terms of what to expect with these types of surgeries. They want to know really what's the best option for my eyes. And our job is to guide them. Is it going to be contact lenses? Is it going to be glasses? Is it going to be refractive surgery? And it's never about pointing them in the direction we want them to go, but about guiding them towards what they need the most. And when a patient asks about LASIK or says I'm interested in certain things, our job is to kind of pinpoint what it is that they're most interested in, looking at their lifestyle, the kind of things that they do on a regular basis, and what type of procedure is going to work best for them. Somebody who may love wearing their glasses, may not be the best candidate for LASIK. But then there's somebody who the glasses, especially nowadays with COVID and wearing masks and everything, where your glasses are constantly fogging up, or they don't like wearing contact lenses, and they're looking for the next best option to really maximize their vision and see as well as they can. Our goal is really to just make them understand what the procedure is about, what it can be done, and really letting them know how safe the procedure is. When it comes to eye surgery, it's one of the most vetted surgeries that there is. The procedures that are done, the machines that they use have to go through rigorous testing to make sure that it's going to be safe to be used on all of us. And so the success rate with the doctors that perform these types of surgeries, as Dr. Manning will probably tell you, is very, very high. So there's very little when it comes to risk during the procedure because of the way that the machines are set up. But risk is inherent in any surgery, and our goal is to make sure that we mitigate those risks in accordance with the surgeon who's going to be working on you.
Yeah, I would agree. In talking with patients, absolutely many come in with feelings of nervousness or anxiety, and in chatting through with them, sometimes we'll give other examples that really help illustrate the levels of success and how so many patients afterwards say, gosh, why did I wait so long to do this? One example is there was a study a number of years back that looked at the rates of eye doctors themselves having vision correction surgery, and what they found was compared to the average population, those who were candidates in the average population versus eye doctors, well, eye doctors had this several times higher frequency than the rest of the population, because we see the results, we know how successful it is, we know the safety level, those things. Similar was found in the rates of eye doctors performing vision correction on their own family members. Again, naturally, if there were a worry, they wouldn't do that. And then lastly, a different study had looked at rates of satisfaction following any elective medical procedure, and vision correction, such as with Lasik, was found to be among the highest of levels of satisfaction of any elective procedure. So pretty neat.
When you have a patient that comes in for something, and it might even be a patient that came in for me that I said I recommend that this person get PRK or Lasik or ICL or something like that, and you say, based on these measurements or based on what I've talked to this patient, I think I would rather choose a different option. So how do you figure out which option would be best for the patient?
Good question. Yeah, so there are a lot of factors that we consider when we think about what will be best for any patient. These include things like our patient's age, what type of prescription or range of prescription they have, other issues of eye conditions or eye health, as well as what their lifestyle and vision goals may be. So all of those tend to factor into what we'll consider in evaluating their best option.
Perfect. All right, so this was just a quick rundown of all the different type of vision correction surgeries there are. Now, if you want to find more information on Dr. Manning and Gulfcoast Eye Care and Dr. Austin and Elevate Your Existence, then we will have a link of their description and bio in the show notes below. Now, don't forget to subscribe to this channel so you don't miss other videos like this one, so you can learn about how to keep your eyes and vision healthy. So stay well, stay focused, and we'll see you in the next video.